Well, a warm welcome to today's talk. It's Saturday the 18th of June. Now, I'd had hoped to move on from COVID by now, but there is some interesting news to report. BA.4 and BA.5 are becoming the predominant variants around the world. Now, this is moderated, or this is facilitated by immune escape. So what's happening is the BA.4 and the BA.5 are able to proliferate, therefore multiply and increase their numbers, and therefore be shed into the environment to reinfect new people in people that are protected by vaccination, and to a large extent in people that are already protected by previous infection. So the evolutionary driver of this is immune escape. That's why more of this virus is surviving, reproducing and proliferating. That is what's happening. Just to give you the bottom line on this video, it's increasing in the United States, it's increasing in the United Kingdom and probably around the world as well. Is it causing more severe disease? No, it's not, than the previous Omicrons. Is it causing different clinical features from the previous Omicrons? Well, again, it doesn't seem to be. There's a slight dark cloud on the horizon that I don't think is going to come to anything, so I'm not going to dwell on it, but I'll just mention it in this brief introduction. And that is an increase in the amount of Delta cases being diagnosed in the UK. Of course, the previous variant that was more pathogenic caused more hospitalisations. I'm not really expecting this to outcompete the Omicron variants, however. So it's been in the news, but I'm not really expecting it to come to anything. So I'm not too worried about it at the moment. Yes, it's a concern for the several hundred people that are infected with it, but I'm not expecting it to proliferate. But if I'm wrong, we'll come back and talk about that. Now let's look at some orientation data first of all. After that, what the video is about a bit. So, I mean, cases, well, again, this is purely due to testing and very inaccurate. But New Zealand and Australia, the trend is certainly down the way. And this does reflect infections in Australia and New Zealand. They are going down. It's pretty good news. The direction is excellent. Other places, though, the United States, Ireland, United Kingdom, Netherlands, Canada. United States, slight uptick in cases. That is genuine. Ireland gone up a bit. United Kingdom, so that's Ireland there, has increased a bit. Again, BA.4, BA.5 driven. And the United Kingdom and the Netherlands also up a bit again. BA.4, BA.5 driven as that increases cases. Much more useful, of course, is the number of people in hospital, because the cases are only a small subset of the total amount of infections, as we know. So what we have here is patients in hospital. Australia, well, that's the Australia line there. It's a gradual reduction, which is good to see. Then Canada, quite a steep reduction. Now, the United Kingdom, there's actually a slight increase in the UK hospitalisations at the moment. As indeed there is in the United States, and small in Netherlands. Now, this is largely driven by the BA.4, BA.5, and I'm really hopeful it's not going to come to much, but it is a concern. And again, I think it just reflects the sheer number of people that are being reinfected. And the slightly ominous thing here is that people infected with Omicron don't seem to be developing high levels of immunity as a result of that infection. Some, but not as much as we would expect with other viral infections, which I'm afraid means we can all look forward to being reinfected on multiple occasions, but hopefully getting milder and milder as time goes on. So this is looking like the emergent endemic picture in Omicron, BA.4 and BA.5 at the moment. Deaths-wise, confirmed deaths, well, the United States, United Kingdom, Ireland, Netherlands, Canada, Australia, New Zealand, in that order. But we notice that these lines aren't increasing steeply. They're increasing a little bit. Ireland, somewhat of an increase there. But most other countries, the line is flattening, but is not flat. It still is. There still are some deaths, and we'll have some figures on that. Now let's look at some things in the United States here. BA.4, BA.5 up to 8.3 for BA.4, 13.3 for BA.5. So BA.4 and BA.5. And the evolutionary driver, as I said, is immune escape. Is it more severe? No. Is it the same symptoms? Yes. Essentially, we believe it's the same symptoms. Hospitalisations, though, are up somewhat in the United States, 4.6 on the week with a 7-day rolling average of over 4,000. So it's not insignificant. Let's just look at some data there from the United States. And here we have the graphic that we've been following, and we see that BA.2.12.1, which replaced BA.2, which replaced BA.1.1, which replaced Delta. We do see that that's being the BA.2.12.1 is being replaced by the BA.4 and the BA.5, which seem to be roughly equally increased. They're transmitting more because of the level of immune escape. That's why they are proliferating. Now, from the States again, number of cases, cases hard to say, but I don't think that's accurately being reflected. I think there is an increase in cases in the States. Well, not cases because that's what's being detected, but they're not accurately representing the increase in infections, which is indicated by the increased hospitalizations. So here we see there's a number of deaths in the United States. Again, this is accurate, of course, and this is still trending downwards. So that is good to see. Now, hospitalizations in the States, which are pretty crucial, as we've said, we do see this increase, 4.6% on the week. There's definite increase in hospitalizations. And if we look at the age groups here, we do see that this is by far, the majority of these admissions are in the over 70s. And these are descending age groups there as we go along from the admissions in the United States. Now, let's go on and look at the situation in the United Kingdom now. As we said, slight increase in hospitalisations. I'm not going to show you too much data from the UK, but I will show you some Office for National Statistics data, which is always pretty useful. So we do see this. Now, it's a dramatic increase, to be fair. The percentage is high of increasing new infections. Now, this is the Office for National Statistics data, which, of course, is based on national surveys, so is by far the most accurate, purely scientific data we have. And we see there's an increase, and it's a high percentage increase. But it's from a relatively low level. So the R value will actually be quite high if we calculated the R value. Quite a steep increase. The question is, where is that going to go? And with BA.4, BA.5, because of its ability to reinfect, because of its ability to infect people that have been vaccinated, that probably is going to go up somewhat. How far, it's difficult to say. But it is concerning that it's proliferating so much in the middle of summer. That is a bit of a concern. Hospital admissions, as we see, slightly up. ICU admissions, though, down. This is remarkably encouraging. Although hospital admissions overall are up, deaths continue to decrease, and basically everyone has got antibodies in the United Kingdom at the moment. It's 99.3%, and I think we can assume that most of that other 0.7% do have some antibodies. It's just below the detection of threshold, although that's speculation, so we can't really say too much about that 0.7. But we can say it's actually not actually higher than 99.3 that have been exposed to the vaccine or to the infection, and it's just inexplicable that the Office for National Statistics don't differentiate between the two by looking for alternative antibodies. Why they don't do that is strange, but they don't. Right, so week ending 11th of June, always a bit behind. Percentage testing positive increasing throughout all the home countries due to BA.4 and BA.5 primarily. Percentages that had COVID-19 in the week, so England we see is back up to 1 in 50. Wales 1 in 45, Northern Ireland 1 in 45, Scotland 1 in 30. Pretty high actually in Scotland. Now this is quite an interesting graphic here. just take a little time to sort of work out what this is saying. Now, this is the estimated percentage of the population testing positive for COVID-19 on the nose swabs, as we've said. Now, the blue line is compatible with BA.1, BA.4 and BA.5. So the BA.4 and 5 are testing the same as BA.1. So we can assume that this blue line now is not BA.1 because that's largely replaced. So the blue line now is, the vast majority of the blue line is representing BA.4 and BA.5. It's just the particular genetic sequences that the tests look for. And basically the red line, BA.2, is going down. So we see that here the BA.4 and 5 are now more prevalent than the BA.2. And we know that that's going to be higher now because this is always a few weeks out of date. Wales, a similar situation. Northern Ireland and Scotland as well. So in we see a difference actually there. So England, the BA.2 is less prevalent, and in Scotland the BA.2 is remaining more prevalent, but the BA.4 and 5 are catching up. Now, how that is reflected in hospital admissions, well, the light blue, of course, is the intensive care, still looking pretty good, pretty low. At the dark blue, there is this slight increase in hospital admissions due to the large number of people currently infected with BA.4 and 5. The vast majority of those hospitalisations are in the much older age groups. Most are over 80. But it's still adding pressure to the NHS, which is already under, of course, immense pressure. How high that's going to rise, I'm not expecting it to get back anything up to these levels. That was the BA.1 peak, that was the BA.2 peak. I'm not expecting to go back up to there, but it's certainly, it would be wrong to dismiss it. Now, this is the admissions to intensive care. The percentage of critical care patients for whom COVID-19 was reported as the primary reason for admission. So we see that's well under 50%, so that's about 40%. In other words, 60% of admissions to intensive care were with COVID-19, not for COVID-19. But again, that shows the high prevalence that's still there in the community, that a lot of people are being admitted with COVID-19 despite the fact they're not being admitted for COVID-19. Now, this is quite interesting. This shows how much COVID-19, SARS-CoV-2, is likely to cause death. So we see that just over 60% of deaths where COVID-19 is recorded on the death certificate are due to COVID-19, whereas these are incidental. These are with COVID-19. And the interesting thing about this graphic that the Office for National Statistics is doing is that comparing that to people with normal influenza and pneumonia, and we see that the people dying from that is much lower percentage, but a higher percentage dying with it. So from that we can conclude that COVID-19 is more likely to contribute towards death than normal influenza and pneumonia. Now, this is the deaths involving COVID-19 decreasing. Week ending 13th of March to the 3rd of June, frustratingly out of date, but there we go. Well, no, that's taking us up to the 3rd of June, so it's 15 days ago, isn't it? Just over 2 weeks ago. But the death rate is going down really quite dramatically, which of course is good to see. And the final graphic I'm going to show is this one, which is really an interesting graphic that the ONS is showing. Deaths due to COVID-19 have been the highest than the death rate to pneumonia. Highest. The death rate of COVID-19 is there. Have been higher than deaths due to flu and pneumonia in any year since. And we go all the way back here, and we see that the last time they were that high was 1929. This huge spike here, of course, is the 1918-1919 influenza pandemic. This was changes in the data here. So here we see deaths due to flu and pneumonia, and we see that the COVID deaths are way higher. Now, this is cumulative data, of course, over the past two. This is basically 2 years of data here: 1919, 1920. published some data into the first half of 2021. But it shows that people who were saying that COVID is just a flu or the same severity as influenza are actually wrong. That data disproves that. So quite an interesting graphic there on the history of infectious diseases, really. Now, deaths involving COVID-19 are down, which is good to see. Week ending the 3rd of June. Now, in the UK, there was 211 deaths registered in the UK involving coronavirus. That's down 258 from the week before. So it is a very sharp reduction in deaths that we are actually seeing at the moment, as that graphic showed in the reduction in death. A very significant reduction in death, which is, of course, exactly what we would want to see. 258 deaths fewer than the previous week. That is a big drop off in the death rate, which is encouraging. Total deaths registered in the UK for that week were 7,881. Interestingly, that's 16% below the 5-year average for this week in that time of year. Now, of course, the 5-year average will have been increased by the deaths in 2020 and 2021, but even so, the deaths are well below the overall the average that we would expect for this time of year. 58.1 disease. In the deaths, 58.1% the coronavirus disease was the underlying cause of death. In other words, in about 40% of deaths, it was in 41% of deaths it was incidental, nearly 42%, and that again, the week before it was 64.9. So the amount of deaths from COVID-19 have dropped down quite a bit from the week before. So again, this is a very, very encouraging trend. More people are dying incidentally with COVID, the death not caused by COVID-19. Now, the antibody data in the UK is well collected by this survey. We can assume that the antibody data, I think, is not too dissimilar in countries where the data is not as well collected, such as the United States and Canada. Of course, we don't know that, but there's no reason why it shouldn't be as good. And they're the figures. It's just incredible. Well over 99% have antibodies. And again, I've gone over this time and time again, why the Office for National Statistics are not differentiating between the antibodies from vaccine and the antibodies from actual infection is just bewildering, to be quite honest. I can only assume that they're doing it so they don't. There's this sort of philosophy from almost 2 years ago now that they don't want to do things to discourage vaccine uptake. But I really feel Office for National Statistics, the public is due that data now, and really think you should start changing your survey techniques and give us the full information, please. But there we have it. That's vaccine or natural infection. Proportion under 16, where the vaccination rates are much lower. This is the antibody levels above the normal 179 nanograms per mil, which is the normal amount to take. 23rd of May to the 26th of May, so well out of date. So we know this is going to be way higher now. It's going to be significantly higher now. It's nearly a month later. But aged 8 to 11, it was 95.9%. And in the 12 to 15, it was 95.7%. So 96% in young people under 16 who have lower uptakes of vaccine. And this is a lot of this has simply got to be caused by natural infection, which will have given a large degree of protection. And that means that the need for vaccination should be considered in the context of that. And a lot of people might conclude it reduces the need for vaccination because people already have young people already have the natural antibodies. The risk-benefit analysis has changed. We are no longer in early 2020 or late 2020 or early 2021. We're in mid-2022. The risk-benefit analysis has changed. And the Office for National Statistics actually state here, Testing negatives means that an individual did not have enough antibodies to detect in the test, not that they do not have any immune protection against the virus. So the number with immune protection against the virus, we can assume from that statement, is actually higher than this in that younger age group, which of course is remarkably good news. So that's just a brief update of what's going on. BA.4, BA.5, it's going to go on increasing for some time. Is that going to, and of course it goes without saying, I think it's going to become by far the predominant global strains, replacing the BA.2 and its subvariants. Some increase in hospitalizations due to the sheer number of infections. Not expecting those to go very high, but immensely disappointed that previous Omicron infection is not giving a higher level of protection. I'm not surprised the vaccination is not giving a higher level of protection, because the vaccine is based on what is now basically the ancient Wuhan type virus. So I'm not surprised there's a lot of breakthrough infections after vaccination, but I would have expected more natural immunity and less breakthrough infections. But good to see that the breakthrough infections are resulting in very low levels of hospitalization and reducing levels of death. So I think we can look forward to ongoing reinfections of a milder form of disease, but possibly in quite high numbers for some time into what's now going to be a BA.4 and BA.5 Omicron era. So good news and bad news, mostly good, but not entirely. And thank you for watching.